Good morning. I am Dr. Madhusudhan, Department of Medical Gastroenterology, Narayana Medical College, Nellore. Today, World Liver Day. So, World Liver Day every April 19th will be celebrated to create awareness among the people about liver diseases. Why awareness to be created? Liver diseases, little known by the people about only jaundice, and otherwise only alcohol consumption people will develop liver disease rather than other conditions. So other than these lifestyle related conditions, sedentary life, diabetes and other viruses, hepatitis B, hepatitis C, other metabolic conditions, accumulation of iron in the liver or copper will result in liver diseases. Known by the people about other causes also will result in liver disease. Other than people have belief that jaundice is the only manifestation, otherwise pain abdomen will result in a liver disease. So other than these, so presenting with a distension, that is fluid accumulation in the abdomen, swelling of legs and altered sleep, that is a part of liver disease because of encephalopathy. These are also manifestations, and decreased hemoglobin because of loss from the stomach and large intestine because of liver disease. These to be known by the people as an atypical manifestation. If you know these, you consult a liver specialist, otherwise physician, to further evaluation of the liver disease. So other than these manifestations, we have to know about 2 million deaths will happening all over the world in a year because of cirrhosis and liver disease. 1 million by the cirrhosis, rest of million deaths by the viral hepatitis and hepatocellular carcinoma. So how to know all these conditions, how to aware about all these conditions and to report to the doctor in the initial stages. So initial manifestations are not that much. Even jaundice will not be manifested in the early stage of chronic liver disease. Whenever decompensation happens, only jaundice will be developed. So what is a normal liver will be situated in the right hypochondrium, that is around 1.5 kilogram in weight, and it is a dark reddish brown in color. It will functions as digestion and filtration process and detoxifications of chemicals like alcohol, ethanol or drugs. All these functions will be affected in a liver disease, and clotting factors also will be synthesized. Hormones also will be synthesized by the liver. In a liver disease, diabetes also will be manifested. Diabetes per se will affect the liver in a form of non-alcoholic fatty liver disease. So while evaluating the patient of liver disease, so we will do liver function tests, in that elevated bilirubin, otherwise elevated liver enzymes. Alkaline phosphatase will be elevated in the biliary tract system abnormalities, and albumin will be decreased in case of the chronic liver disease. In routine complete blood picture, hemoglobin will be decreased because of loss through the intestines, and platelet count will be decreased because of the enlarged spleen that filters the platelets sequestrated in the spleen. And what are the various complications these people will be developed? So people will develop sudden blood in the vomitus, that is hematemesis, because of the rupture of the dilated engorged veins in the upper GI tract or lower GI tract in liver disease. That is very common. These are called esophageal varices or rectal varices, resulting in the chronic anemia, that is low hemoglobin. And other than this, hepatic encephalopathy, patient may develop altered sleep pattern, disturbed night sleep, more daytime sleepiness and personality changes, behavioral disturbances. These also to be identified by the family members and doctor, and by examination for the flapping tremors like this. When you extend the arm, that flaps will happen. this is a feature of the hepatic encephalopathy. And fluid accumulation in the abdomen and legs are also part of the liver disease. Most of the people, swelling of feet and legs, otherwise fluid accumulations, think of either cardiac or renal disease, but also liver disease to be considered in this diagnosis. And how we are going to treat all liver diseases? What is happening in the liver disease treatment? So most of the people will take native medications for the jaundice. These native medications, also chemicals, will affect the liver and result in the chronic liver disease, that is cirrhosis, or result in the hepatocellular carcinoma, liver cancer. So avoid native medications, avoid excessive medications, those will also cause liver injury. And using the medications to reduce fluid overload like edema in the legs or fluid in the abdomen, those are called diuretics. Those to be used judiciously, cautiously, not to give high doses, to be monitored on daily basis by renal function tests, because these people will develop for a renal failure, that is kidney injury. In case of the decreased blood volume, kidney will be injured and renal filtration will be decreased. That to be prevented by the regular monitoring of the renal function tests and judicious low dose administration of the diuretics. And to reduce hepatic encephalopathy, we will give medications by eliminating the ammonia, giving the lactulose. It will be most helpful. So other than this, when people have to go for the upper GI endoscopy to look for varices, those are esophageal varices, enlarged, dilated, tortuous veins because of the portal hypertension developed in the liver disease. And same time sigmoidoscopy for the rectal varices, those will present with blood in the stool or hematochezia. And important thing to prevent all these liver diseases and liver cancer are, by doing regular exercise, will prevent chronic liver disease, NAFLD, and liver cancer by preventing the NAFLD, and by avoiding excess fat and high carbohydrate also will prevent, and regular screening for the hepatitis B and C viruses and giving vaccination for the hepatitis B will prevent the chronic hepatitis and chronic liver disease. And identifying the people in a proper time for the liver transplantation in a chronic liver disease, then survivability will be more for the liver transplantation rather than people identifying in a later stage for liver transplantation, and will prevent liver cancer also. So thank you very much. Thank you.